Hello, my name is Dr. Martin and GP in Newcastle on the Line, Highland Surgery. So yes, we are going to talk about the pre-diabetic, which is a chapter that I wrote in the book.
Well, one of the reasons that we're here, Marcelino, is that I've been so impressed by the fact that you've taken a real interest in patients and you're trying to help them before their health condition becomes really obvious. Now, in this particular instance, we're talking about the time before they develop diabetes, when if only people make some changes to their lifestyles, they might not develop diabetes. So what sort of things are the most important for people to do to try and stave the idea of having diabetes, keep it away from them?
Thank you, Dr. Chambers. Yes, I think it does the beauty of the pre-diabetes is that we had an opportunity, a window opportunity, unique one, where we can reverse the condition. And you don't need to invest too much in medication or expensive drugs or anything like that. It's all about lifestyle. And people say, okay, but what is lifestyle? We mention a lot about lifestyle. So it's changing things that probably we do wrong and we don't know that we are doing wrong. So things like what we eat, when do we eat, how much, portion size, how much do we exercise, how much do we sleep, how much alcohol do we drink. So if we look into those things and we reflect a little bit on it, there are changes that we can do that they don't cost any money at all, and they can be of great benefit to reverse this condition, pre-diabetes, without doing anything. In a small percentage of people can reverse back to normal, but the majority of them, they progress to diabetes. And once you progress to diabetes, this is very much a chronic condition.
And the other thing about the chronic condition, we're thinking about the book, is that if you've got diabetes, you might develop more chronic conditions. Like I believe chronic kidney disease is more common in people who've got diabetes. So it's not just you trying to help people not get diabetes, it's then all the other kind of health problems.
Absolutely. Yes, one of the main risk factors to develop diabetes is obesity, and alongside with the obesity, sedentarism, not doing any exercise at all. So it is very important that we can basically change our diet, habit, as I said, the way we eat, what we eat, the amount we eat, and we start moving. You can start with simple exercise, something like you can afford, like walking, brisk walking, something like that, and then you can build that from there. And that is something that you can export to all the age range, so from younger to more senior and elderly people as well. So that is the beauty of here. And when you get a benefit from the pre-diabetes, you also get the benefit about weight loss, hypertension, reduce your cardiovascular risk, which is the risk of having any stroke or any heart attack or anything like that, and reduce the risk of cancer, improve your mood as well, reduce the possibility of developing depression, and very interestingly as well, reduce the risk of suffering from dementia of any type.
And do you think there are any apps or websites that people ought to look for to help them to do that sort of self-care?
Absolutely. I think it is in this age where almost everybody is having a smartphone, or if you are someone who are 70 or above and you are not very familiar with them, I'm sure that you got a relative or someone who can help you with that. And you can watch videos and very interesting apps, as you say, where you can find reliable information. Not everything that is out there in the internet and the media is right, but those apps that you mentioned, they are very much helpful for having additional information, reading videos, and to have a little bit of the history from some people who had gone through similar situation, and they are much better now, and they are a good motivator for you as well.
And are there any apps that you use yourself to stay fit and well?
In the book that we wrote, there are a few of those, and yes, they are very, very helpful.
Like couch to 5K, that is a very common.
That is a very common one. It is for people who, how can you start exercising, walking, and there are many. I wouldn't say that there is one better than other. It's something that is suit each one, depending on your lifestyle and so on, or your preference for exercise. So I wouldn't recommend just one. There are a few in the books that you can look at them.
And so would you strongly recommend this book for people out there, for themselves and maybe for a loved one?
Absolutely, yeah. This is not a book like the people say, a book, plenty of words over there and boring. No, this book is just full of advice. It's very colorful, very much up to date with the app, the address of the app as well. They got cartoons. The language that the authors they use on that is very plain language that everybody can understand. So I think it's very, very entertaining actually. Even the cover already is quite kind of provocative, something that it will catch your attention immediately as well.
Well, people have said to me in community groups, this is the first time I can understand what a doctor's telling me.
Absolutely.
Because nearly every chapter is written by a doctor or another clinician, isn't it? Mm-hmm. Or an expert.
I think it's useful as well for junior trainees as well, like foundation year doctor or especially trainees, because one of the most important thing in consulting with patients is the communication. How do you explain technical jargon to patients in order to motivate them? So if you throw a few jargon words, the patient really lost interest on that. Whereas if you explain things in plain language with lay term, it's most likely that they motivate them, they will understand, and they will engage into any behavioral change.